Good morning, everyone, and welcome to today's highly anticipated webinar, Optimizing Mental Health Clinical Workflow and Documentation with Clinicom. We're thrilled to have so many of you joining us from various corners of the healthcare industry. Your presence today underscores the collective commitment we share in advancing mental health care and enhancing clinical efficiency. Now, before we dive into the heart of today's session, I'd like to introduce our esteemed speaker, Ignacio Handal. Ignacio is not just the visionary in the field of healthcare technology. He is a driving force behind innovative solutions that are reshaping how mental health care is delivered and managed. With a rich background in clinical trials and in the healthcare technology industry, and with a deep understanding of the challenges that clinicians face, Ignacio has been instrumental in developing Clinicom, a platform that stands at the forefront of clinical documentation and workflow optimization. Ignacio's journey in this field is marked by a passion for leveraging technology to make mental health care more accessible, efficient, and effective. His insights have been shaped by extensive experience and a keen eye for evolving needs of both clinicians and patients in the mental health space. Today, Ignacio will share with us not only the features of Clinicom, but also his vision of how technology can transform mental health care. We'll dive into how Clinicom accelerates clinical documentation, aids in clinical decision-making, and integrates crucial aspects like biopsychosocial factors, complete patient histories, and social determinants of health. Moreover, we'll highlight how Clinicom's innovative approach to outcomes tracking and staff outcome monitoring can revolutionize your practice. So without further ado, please welcome Ignacio Handal.
Thank you, Marcus. I appreciate the introduction and welcome everybody to this exciting webinar about Clinicom and helping you guys optimize your clinical workflow and documentation process and helping your patients evaluate their mental health status. So we're excited to share both Clinicom and our augmented intelligence with you. Marcus, if you could, let's start with the first slide. So just as a beginning, we wanted to just go over some quick disclosures, a little bit about us, and we'll roll right into the product. My name is Ignacio Handal, CEO of Clinicom. A couple of disclosures, we have done a litany of different phase 1 through 3B clinical trials for various pharmaceutical companies since 2003. You can see some here listed. And so we've worked for various sponsors and actually doing clinical measuring mental health for various clinical trials. We've started Harmonix Neuroscience Research in 2003. It's an leading independent pediatric and adult CNS research institute that's done a litany of clinical trials. Again, founded a research institute for the third largest surgical center in the country, the fourth largest ophthalmological practice in the United States, and obviously serving as the CEO of Clinicom currently. Next slide, please. So the learning objectives for today is really learning to how Clinicom can help optimize your workflow. So really, we're going to go over kind of just real quick, what is Clinicom, some of the biopsychosocial elements and domains that Clinicom covers, examples of some of our algorithms. We're going to look at some of the value of the data that we're capturing for clinical research and other purposes. We're going to go through some workflows of kind of how do you send a Clinicom, reviewing this with a patient, how do you document this, how does this accelerate your clinical documentation, reduce your burden, and really optimize your day as a clinician or reviewing clinical cases. And we'll go over a couple clinical cases themselves, looking at the reports. How do we look at the diagnosis, and also looking at some of the follow-up assessments and statistics and population health stats. So, just to kind of summarize the main issue that Clinicom aims to solve is, there's as hard as most mental health providers work and the detail they put into their patients, there's still a strong and a serious mental health epidemic in our nation and the world. It's also part of it is there's a lot of misdiagnosis in mental health. Primary care misdiagnosis rates reach an average of 65.9% for major depression, and for some other conditions, it's much worse. So primary care physicians need to be empowered with data to help make them make better decisions. And even trained professionals in the mental health space still have an average misdiagnosis rate of about 39%. So the aim of Clinicom is to really improve those misdiagnosis rates and get to the answers quicker. Next slide, please. So what is Clinicom? Clinicom is the world's only comprehensive mental health platform that can assess and monitor 80 mental health conditions from a single adaptive machine learning assessment using adaptive augmented intelligence and current clinical standards. Clinicom can be easily integrated into most EMRs, to most telemed platforms, digital therapeutic tools, or electronic data captures for clinical research. Clinicom is HIPAA and FDA Part 11 compliant. Clinicom is very secure. We secure the data twice the level of most banks. It's a safe place for patients to tell their mental health stories and their journey, and to share this information with their clinicians prior to meeting and engaging with a clinician. So we like to say Clinicom understands so that patients can be understood. So what elements of information does Clinicom gather for you? So remember, this is all gathered autonomously prior to seeing your patients. We cover a litany of information, some of the biopsychosocial domains that we capture, aside from some of the diagnostic criteria evaluation and assessment, is general medication. So we have a complete FDA formulary, details about the chief and secondary complaints, lists of conditions with the severity and details of the symptoms. Also, Clinicom generates a narrative, captures simple things as allergies, treatment histories, all the way to conception and pregnancy and birth, down to development and some other factors. Clinicom also has two comprehensive assessments, DSM assessment-based assessments. One is called Clinicom, the other is Clinicom Pro. Clinicom Pro is a little bit, it's a deeper dive into your patients. It's about twice as long as Clinicom, the regular Clinicom. It can capture information as far as past psychiatric history, medical histories, military history, family history, down to their support system, quality of life, and even if the patient's having legal issues or other issues. So it's a lot deeper assessment. Clinicom is not a survey. It's important to understand that Clinicom is an adaptive intelligence. We have 255 algorithms. The important thing to know about Clinicom is that you don't have to know specifically what's going on with your patient or assume what their chief and secondary complaints are. You send a Clinicom and Clinicom figures it out. So the algorithm here is the algorithm for depression. The algorithms are very complex. So just the image here is to illustrate the fact that it is not a survey. As you answer questions within Clinicom, different doors open and close, different connections are made between conditions. And so this image is really just to illustrate the complexity of the adaptive intelligence. And obviously there's 255 of these. Next slide. So what is the value of Clinicom for your patients? Well, so Clinicom doesn't forget to ask the right questions. Clinicom can uncover most mental health conditions. We do not do neurodegenerative disease and some personality disorders, but the majority of mental health conditions Clinicom can assess for. This is a safe way for your patients to tell their complete story from their couch, from their home, or a safe place with no time limits, and they're able to express the complete mental health journey with their clinician prior to engaging with a clinician. This is really powerful and helps you get to a quick start. The value for clinicians is really to be able to improve rapport with your patients, gather this information, and empower you with the information to make the best decisions. It can reduce the number of visits required to get to a proper diagnosis, and reduce the number of visits to stabilize your patients. Clinicom is not a diagnostic tool. It is an assessment aid, and clinicians have complete diagnostic control of accepting and rejecting a diagnosis. Can also improve the bandwidth for emergency rooms or any clinical setting. Clinicom is built to be ubiquitous to any care setting, from an ER to a school or anywhere there's a mental health clinician that can help assess their patients, or even primary care settings to help empower primary care settings for care navigation. Clinicom will also track medication effectiveness and treatment outcomes over time. Also, Clinicom is reimbursable for most qualified health from majority of insurances. There's also tremendous value in Clinicom for research. We are very avid CNS researchers. We've used Clinicom to screen and assess patients for our studies. If you want to triage a large group of people, population health studies, do it in a FDA Part 11 compliant manner. And, for decentralized clinical trials, we can talk more. There'll be another webinar more about the functions and other layers of Clinicom for clinical research. But there's tremendous value in finding the right patients, making sure they meet exact inclusion and exclusion criteria, and doing comprehensive assessments. So Clinicom has, tremendous clinical utility. We have a huge, also past our initial assessment using Clinicom for assessing the initial 80 conditions. Clinicom also has a huge library of standardized tools licensed to us that you can use to track and monitor your patient once you've made a determination of what their condition is. We also capture, social determinants of health and dozens of other informational questionnaires. And this tool is not only meant to do an initial assessment, but to track and monitor your patient for MIPS or HEDIS measures, and to also provide you with statistical mapping of population health data as well. Okay, so as we're going through this, if anybody has any questions, wants to schedule some time with us, or request some free training, you can always go to clinicom.com/onboarding. There's a lot of information on there to review, and it's a great way to contact us. You can schedule a meeting with us right through that link to get going. There's our clinical guides can be found there, training videos, a billing guide as well. And if you'd like to, if you check out this presentation, you'd like to have a free trial at Clinicom and test it for yourself. So there's a risk-free trial with full access at Clinicom/free trial. So feel free to check out both those links post the webinar. All right, we've spent many years working through clinical workflow for Clinicom. The key thing is our goal is to lower the burden for your scheduling staff, for your clinical staff, and your billing staff, to make things easier, to make your lives easier in gathering information, and really optimize your workflow. So, the clinical user roles and tasks, you have your scheduling technicians that will probably be sending Clinicom as soon as your patient calls your clinic to book an appointment, instead of waiting, a couple weeks to be seen, or a couple days. Average wait time in the United States is 4 to 6 weeks right now. The moment a patient schedules and books an appointment with the Clinicom site, a link is sent to them, and they're given the opportunity to tell their story then the moment they book their appointment. This is truly powerful, and most patients really feel engaged. It's very cathartic for patients to tell their story and have a safe place where that data is stored permanently, and they can move that data around to different clinicians. The clinicians side of Clinicom is really reviewing the Clinicom report, reviewing the diagnosis, making clinical determination of accepting and rejecting a diagnosis, and then setting up a follow-up. The third layer here of the workflow is really your billing staff. There's some features in Clinicom to review potential billing opportunities for qualified health professionals, nurse practitioners, and above. All right, so today we're going to look at how to send a Clinicom. It's really easy to do. You enter a phone number and email and hit send. We'll be looking at how to review the report, accepting or rejecting the diagnoses, the clinical documentation shortcuts that we're going to go through, how we can automate some of this for you and automate the follow-ups, and then we'll go into some of the population and cohort level statistical outcomes. All right, so I thought a good way to look at this would be to look at a couple patients. We might not get through all of them, but we'll look at some patients specifically. So we'll jump in here and start driving around Clinicom. So every Clinicom has a Clinicom portal or site that your site would have. This would be branded to your company. You would see basically your logo instead of the Clinicom logo on the top right. Clinicom is device agnostic, so any PC, Mac, any device, tablet, you can even use Clinicom on your phone. It is web and cloud based, so you don't have to download any apps. Clinicom is very easy to learn and train at scale for large enterprise clients down to small provider settings. Let's just try to show you how to send a Clinicom very quickly. You can go to your My Patients tab and click Invite a Patient. Here you'll see there will be 3 options. You can send a Clinicom Pro, which is a comprehensive assessment for 80 DSM conditions. It also captures all the biopsychosocial and family histories, and it's a deeper assessment. Below that is Clinicom. Clinicom proper is an 80 DSM condition assessment with some history and family history, medical histories, but it doesn't capture the deeper biopsychosocial, social determinants of health and quality of life measures. So, typically Clinicom Pro is sent inpatient hospitalizations, really SMI, severe mental illness. If you've got an established patient, just want to assess them for conditions and not all the other biopsychosocial elements, you can send a Clinicom. So the point is your scheduling staff would be in here, and patient calls, makes an appointment. They just very quickly click on which assessment to send, enter a patient's phone number or email. We recommend doing both, typing in the phone number, and then hitting send. That is it. It's that simple. Clinicom is sent to your patient. Your scheduling staff has some features in here that we can review in a different webinar as far as monitoring completion. We have a 94% completion rate with no human intervention. We've spent many years working on some soft communications to patients to get to a 94% completion rate across the 33 states that we're currently at in the United States. So patients complete their Clinicom, they're excited and engaged to meet their clinician. They've told their story. And so the day that they walk in to see your clinician, they're excited to see the result. And the clinician has all that information before seeing the patient. So as a clinician, seeing a patient, the first thing you would do is go to your patients tab and look for your patient. You can search for the patient by last name, date of birth, or just start typing and then will come up. This is our case study. Everything here has been de-identified. I just want to quickly point out here that we took out people's first name, anything identifiable, and just put the title as their name of the condition that these samples have. So anywhere in Clinicom, when we're looking at one of these, if you see, first we're going to be looking at a depressed child, 16-year-old male. So anywhere you see in the Clinicom depression, it's really going to have the patient's name. So you can replace the word Bob, for example, as a patient's first name. So let's open up this first patient and look at it. We're starting with low complexity patients. The key thing to remember is when you send a Clinicom, Clinicom figures out the age of the patient, who is reporting on the patient. Is it self-report? Is it the mother reporting on a child? Clinicom can be used on anybody with a sixth grade reading level or higher. The questions are very easy to understand and basic. The main point here is you send a Clinicom, Clinicom figures out who's answering questions and what questions to send. So you don't have to pick from a list, or you basically send Clinicom and Clinicom generates a report. You can see here on the summary page for this patient that both the mother and the teenager filled out a Clinicom. What's really powerful about Clinicom is if Clinicom realizes that the reporter is a parent and the patient is a teenager, Clinicom will automatically prompt the parent to enter their teenager's cell phone number, and they can opt in or out of sending them an assessment as well. This is free of charge. We call this our 360 assessment. So here you can see an assessment of both mother and the teenager's self-report. This is only the summary page, so this is not the meat and potatoes of the Clinicom. This is just the overview where you can look at the conditions that were triggered and by severity, so you can have as a clinician a starting point to say, hey, this patient is looking very, has some persistent depression, some insomnia, some irritability. We also have some standardized metrics that were done on this patient, so you can see and compare those, and some very light OCD on this patient. The key distinguishing factor here between the two assessments, between mom in the bottom and the teenager at the top, is, mom did not have really good insight into the child's sleep and other things going on with them. So having looked at this patient, you can see here that we're going to open up the detailed report. And so this is really where we get started on a clinical case. Clinicom does gather demographic information. Everybody's report is slightly different. And there are at the top of your Clinicom report some standardized assessments. These standardized assessments are what we call our control arm. Every site has a different control arm. So you can tell your Clinicom client success rep that you would like to standard, on every patient monitor certain assessments. This case, the control arm was a PHQ-9, GAD-7, and audit. So for depression, anxiety, and substance abuse, you can see here a mild PHQ-9 score of 8, but they score pretty high on our DSM-based persistent depression and really high on a suicide warning. So the summary section of the report kind of helps the clinician guide to what are the most, important conditions to address, and creates a summary of what that might be at the top of the report. You'll see at the top also questions about who the reporter is, if this was voluntary, or if they agreed also to be truthful. The first big important section in the Clinicom is the chief complaints. In the chief complaint section, you can understand what the patient is, the main complaints that they're wanting to address. For this particular patient, it's depression, and also some secondary complaints about irritability, anxiety, sleep difficulties. And so the starting point for every Clinicom is identifying the chief complaint and as many secondary complaints as they want. There's a multiple choice on the complaints. They can also hit other, but this is a starting point for the algorithms to start understanding which doors to open and close as far as the questioning. If you're building this case for your EMR and want to move this over, obviously we can API all this info into your EMR, but there's also some quick workflow tools to capture this into your notepad. So just by clicking the subsection here, you'll see that this clipped, this little round circle here, it will clip the section into your notepad as you're building maybe your note for your electronic medical record. And you can always paste that right in. So here you can see some of the standardized tests. You can clip that into your notepad as well and keep going as you're building your case and your documentation. Here you can see also for ADHD, this patient had very few symptoms of ADHD, and you'll see here that it did not meet criteria. So an important point to make here is that Clinicom assesses whether or not the symptoms qualify per the DSM criteria for that condition. So for ADHD here, you'll see that they did not meet criteria, as well for panic. So this kind of shows you where you can or should not spend time reviewing with the patient. This patient did have some depressive symptoms, and it looks like they did meet criteria here. And it talks here in some detail about those symptoms and where they're emanating from, as long with also with some of the suicidal ideations and reviews, any attempts they've had. So this is a very complicated algorithm that we can share later, but you can also copy these elements into your clipboard. So basically you're adding elements without doing a lot of typing. Clinicom can really save you a lot of time in reviewing this information. And so you'll also see segments in Clinicom where the patient can expand and tell a little bit more about their story. So there are various types of questions, multiple choice, free text, and others. And so every section is different for every patient. Every Clinicom report is also tailored to each individual patient, which is also very important to note. So different sections may present in different patients. So this is a teenager who seems to have some other issues going on as well. And the key thing here to note is that Clinicom does not diagnose. Clinicom makes a suggestion. The clinician can then accept, reject, or rule out the diagnosis. This is a patented feature that is unique to Clinicom, and basically saying, hey, clinician, we're not here to diagnose anything or treat anything. We're providing you with the data, and you're the trained clinician. You make the diagnosis. So here, for if we review the depression symptom with the patient, validated the points, validated the information the patient gave us, we can then accept, reject, or rule out those suggestions. And this will actually enhance your workflow. So as a clinician, the only thing we're really asking you to do in the system is to accept or reject the diagnoses, because this will actually help you create your follow-up and automate the tracking of the patient. So really, this is the one key function that we ask clinicians to do. So for this particular patient, I'm going to accept a few conditions, and I'm actually going to reject a few others here. So this is OCD and is very light, so I will reject this one. And for anxiety, the score is kind of moderate. So I'm going to leave this as rule out for this particular patient. So as you're reviewing this, this is a great educational tool for patients as well. You can drive to certain sections of the report by clicking on the icon at the bottom for the different sections of the report to make driving to those sections very easy. You can review this with the patient. And let's just say the patient in reviewing this says, you know what, doc, I've been depressed, but I put 8 and I really wanted that to be a 7. You have complete diagnostic control to adjust the severity of the output. You can make it worse or better. Once again, clinician driving the entire time. The entire report can be very easily printed and filed if you don't have an electronic medical record system, or it can be also PDF'd and digitally put into your file, so you don't have to really do any typing or clicking. And once again, all this information can be automatically API'd into your EMR. So this is a depressed teenager. We showed the 360 assessment. Another important facet of Clinicom is our narrative function. So for every patient, it will create a detailed narrative of conditions that you've accepted, and it will follow through. So this is a light complexity patient. I'd like to jump to a little bit more of a complex case, a SUD case, a substance abuse patient. So we'll pull them up. As you can see, they have a little bit more going on. And once again, Clinicom is adaptive to the reporter. So this is a self-report on a 23-year-old male with some cannabis use and some other drug abuse, some suicidality, potentially some ADHD to look at. This patient's had a couple assessments over time. So the key thing about Clinicom also is on the summary page, you can review those follow-up assessments and see how things have been getting better or worse over time for your patients. Clinicom does track change from baseline and changes from your baseline assessment and also from the previous assessment. So you can see individual graphing for conditions over time or group graphing of conditions across multiple reporters. It's important to note also that everybody's narrative is different. So these are not EMR templates. These narratives are specific to the symptoms that the patient's reporting. Notice here it says substance use disorder. So we changed this patient's name to de-identify him to substance use disorder. It could say Mike Smith here, for example. So it will automatically put the patient's first name in here in the narrative for you. The narrative is not intended to be just copy and pasted, but more of a template for you to use to help you along your way in creating your note for your SOAP note. Clinicom also graphs these outcomes over time. So you can actually look at different conditions over time with the patient on your telemedicine visit or in person. A lot of our clinicians actually have a monitor where they're sharing this with their patient. And this is really helpful for patients to track and trend kind of what they're experiencing and seeing over time as well. This is a very helpful tool to review, with your patient at the same time that you're actually going through and looking through. The key thing to note here is that the reports are very different for different patients. So this will also capture any medications, current medications and past. We have an entire FDA formulary that's already updated every night. So they don't have to do a lot of typing. If they start, typing ZOL, Zoloft will pull up all the current doses. Makes it very easy for patients to enter their medication. Again, all this can be API'd into your EMR. Here you'll see the conditions that have been accepted or rejected by the clinician. And again, a summary for this particular patient. They had a pretty high DAS-10 score, which also aligns with the findings of the Clinicom algorithms for substance abuse. You can see there's some acute stress going on, mild OCD, and some other things. The chief complaints here were really around substance abuse, traumas, and other things this patient had experienced. And so if the patient says they don't use drugs, have not used drugs, and will not use drugs, then why ask them about a bunch of drug abuse? But if they do, and they've said that they've used alcohol and cannabis, the algorithm is then triggered and then starts asking them about their substance abuse for various substances. And for each substance, it details the use, the explanation of their history of use, when they first used, last use, misuse, daily use amount, age of onset, and other things for each of those substances. So unlike the depressed kid that we looked at previously, that didn't have all this because they were not on any substances. So once again, Clinicom asks the right questions of the right patients and captures all this history. For example, this patient said, no, that we've never used methadone or Suboxone, so why ask more questions about that? If you see a section that is collapsed and that doesn't have a lot of questions, it doesn't mean that we don't have more questions for methadone or substance abuse. It just means that they were not asked because this patient didn't need those questions. Again, right questions for the right patients. If you want to look at the actual questions that were asked for this section, you can always hit the little question mark button and pull up the questions that would be for that section. So if they had answered in the affirmative, they would have got more of these questions. Again, all our questions are copyrighted, Handal and Handal 2008. So they are all registered and copyrighted questions. This particular patient had, amphetamine use, a lot of different drug use as well over time. You can actually, it also, once they've, admitted that they're on some substances, they will review tolerance, withdrawal, and any, overdosing or information, historical use, or description of any withdrawal symptoms as well. It will also cover any kind of, substance use criteria, right? Failure to do obligations and some other information. So as you're looking at this patient, you can obviously be building your notes on the side to copy and paste. And then obviously you can copy all your notes and paste them directly into your EMR. So Clinicom's goal is to reduce the amount of typing that a clinician has to do, gather the right information, help you make determinations, help you make those decisions, and help lower the burden. So you're not spending the first 30 minutes of your clinical encounter asking subjective questions. With Clinicom, you enter the room with the patient, empowered with all this data, ready to get to work, know which conditions are the most severe and where to go. And obviously you can dial that in with your patient one-on-one. The other information within this specific case, there's some significant ADHD here as well. It looks like mild 3 out of 7 ADHD. So we can clip that into our note as well. It'll capture all that for us. You can see here also some PTSD symptoms that have emerged, moderate 4 out of 7, and didn't have a whole lot of generalized anxiety disorder, so that those questions were not elaborated on. This patient did have some other, this is actually a Clinicom Pro, so this patient actually had a deeper assessment going for their past legal issues as well. So Clinicom is tailored to your patient, to their case. If it's basic, depression, anxiety, down to severe mental illness for bipolar, Asperger's, schizophrenia, Clinicom knows the right questions to ask of the patient and can assess those things. So let's look at a little bit more of a complicated case. I think it'd be helpful to assess and to look at this PTSD patient here. So this is a military veteran, 42-year-old male, top right corner. And this is a complex case. So here in the summary page, you can see that Clinicom evoked multiple algorithms, and they may have met criteria for several conditions. This is, a real case. And the beauty of Clinicom is it's tailored to the complexity of the case. So a typical Clinicom can take 15 to 25 minutes to complete for somebody who's got 1 or 2 or 3 things going on. This is a very complex case with a lot of history. So, as a clinician doing an inpatient intake, this could be an hour or 2 intake. This was all done autonomously with the patient on their couch, saving a ton of time for your emergency room or your clinical intake staff at an intake hospital or inpatient hospitalization. Your patients not only will give you more information and more accurate information, but this will be done without having to rely on an intake staff who may ask, include their own biases in their question asking, depending on the time of day. Maybe it's 2 a.m. and they're tired and didn't ask some questions. So the beauty of Clinicom is that it always never forgets to ask the right questions, is never late. It works 24/7 and gets a deep intake on everybody, no matter how complex the case is. So let's dive into this report a little bit and look at this SMI case for a veteran who had, taken several medications and has a lot going on. So you can see here that this is a different report than the others that we have showed. Clinicom cannot diagnose learning disorders, but it can flag and assess for if you need to evaluate those deeper. Also, it has assessments for irritability, violent tendencies, traumatic brain injury. So you can actually look here, this patient has a high irritability index, and may have had some other traumas. So, and there's also an aggression warning. So Clinicom has an aggression warning that is flagged, and actually can be, clinicians can be alerted SMS or text message to any inbox they want for any of our alerts. So if you say, hey, let me know if my patient has a suicide warning or 5 or greater, and send it a text message or an email to this inbox, we can do that. That's customizable as well. So you can see here that this patient's main complaints were mood instability, and also some conflicts with peers. And so they did not disclose a lot of chief complaints, but regardless of their initial disclosure, Clinicom algorithms did deploy and expanded extensively for this patient, and covered the majority of their conditions. Here you can see the ADHD symptoms they may have been experiencing, that this patient experiencing some mild panic as well. You see those, and obviously reviewing this with your patient one by one is always very helpful. And in the PTSD section, this particular veteran experienced, witnessed, and learned of traumatic events. He was actually had some sexual abuse as prior to joining the military. So this was actually had trauma before becoming a soldier. So, pre-deployment or post-deployment screenings, as we say, is always very helpful to understand. Putting a traumatized person on the front lines may not be the best idea. So this Clinicom would pick that out. Also reviewing, exposures, negative emotional state, diminished interest, and kind of expanding on their traumas. And then also expanding over here on their depression. So this will really help guide the clinician as to, what things to focus on in this particular patient. What's really interesting about this patient is not only the triggering of the irritability index, but this was a Clinicom Pro. So there is a complete history with allergies, conception, birth, their sexual development, early temperament, past psychiatric history, if any. If there are no past psychiatric history, why ask the questions? But if there are, it expands. Past medical history, here you can see that there was a head injury, and it did open up some more questions about the head injury and understanding the concussion, and if there were, if the concussion, if they were had any mood changes or not because of the head injury. So this really can help you understand, is this a TBI case, or is this behavioral health stuff? This patient was a veteran, so they did say I was a vet, so they got the military history questionnaire. Obviously, if they weren't a veteran, they wouldn't have got these questions. This is very helpful to understand their deployment and other information. And then you can also see here family history, medical history, also very important to understand, especially for this particular patient, where you can see here there was schizophrenia, some genetic family preloading here. Schizophrenia experienced by maternal grandfather, also behavioral problems experienced by mother and brother, irritability experienced by father and brother. So this is a really helpful tool to understand not only your patient, but the biopsychosocial elements and the family histories, elements that help attribute to their lives. That also, because it is a Clinicom Pro, does report on their support system, which is also very helpful to understand the biopsychosocial elements of your patient. It does go over safety as well, as there was potentially some safety issues for this patient. So, it will show abuse, emotional abuse here. There was some sexual abuse, and some other issues here. So this is not only a assessment to understand if what behavioral health conditions this patient may have, but also understand the stressors they're experiencing. This patient experienced divorce, physical abuse, sexual abuse, and the other stressors in their life. Because this is a Clinicom Pro, again, it will ask about their education, their employment status, their legal status, and down to their quality of life. So this is a really powerful tool. Clinicom Pro is a deep assessment of somebody's mental health. And obviously you can track and monitor this patient over time. So one of the key things that makes Clinicom really powerful is not only helping you guide and understand what conditions to address and which are the most pressing for your patient, but uncovering hidden comorbidities. So we've seen things like abused women who, maybe report on their Clinicom that they're being abused, but they can't verbalize it because their partner's coming to their mental health provider sessions with them. We've seen Clinicom uncover schizophrenia with nihilistic ideations that nobody stopped to ask about, suicide attempts that nobody stopped to ask about. And it's not that clinicians, if you had 3 or 4 hours with every single patient, that you couldn't gather all this information yourself, but really empowering you to have all this information at your fingertips the moment you walk in to see your patient is really, truly powerful. Not only it accelerates the course of care and care navigation, but helping your patients feel listened to, heard. We have comments from patients like, nobody ever asked me that before, or, nobody asked about my traumas, or, uncovering things that usually may take 3, 5, 6 visits to unearth. So Clinicom is very powerful from that standpoint as well. The other elements of Clinicom that are interesting and powerful for a clinical setting and workflow setting is not only gathering this information and making it easy to put in your EMR, but also looking at the different types of patients, right? So, looking at this bipolar female, you'll see also that there is a little bit more going on with this patient as well, like the one we just previously showed, but they're showing here some bipolar symptoms, persistent depression. So the key thing here, unlike some of our competitors, Clinicom is not just putting out a PHQ-9 and saying, hey, this patient's depressed, which happens a lot. People send an EMR PHQ-9 or doing a PHQ-9 and EMR. The reporter is not identified. Is it the nurse answering the questions in the EMR? Are they actually asking the questions of the patient, or are they just clicking the template? With Clinicom, you know who the reporter is, how long it took to answer the question. It's Part 11 compliant. So data integrity, and in clinical research, we call it ALCOA, right? That the data is attributable, legible, contemporaneous, original, and accurate. So with Clinicom, you have that security of knowing that where the information came from, who reported it, and the severity. So for this bipolar case here, female, 40 years old, you can see that there is, a lot of things going on. So you can actually jump down with Clinicom to the section that you want to review. In this case, we're going to look at the major depressive symptoms for this female. You can review those. This is also a Clinicom Pro. And here you can see the manic symptoms that they're experiencing. They're pretty significant. And here she's saying it was 7 or more days. Clinicom suggested a diagnosis of bipolar 1 for this patient. If it was less than 7 days, or if they put the last manic episode, it would adjust, is it bipolar 1? Is it bipolar 2? Clinicom makes that suggestion. Obviously, you can, as a clinician, can override those suggestions and detail out anything you'd like to focus in on this patient for. The other really interesting aspects of this is, capturing a lot of this information is very helpful to understand the treatment history and the course of care that they've already experienced, which is sometimes lost in translation and not really provided well through patients. So here you can describe, here's a head injury and a description of that as well. This patient was not in the military, so obviously they didn't get this section was not expanded on. Once again, the right questions for the right patients. It does detail out, a lot of patients are quite revealing of the details and family history and the support systems that they have. So this is really, really powerful information to have on your patients prior to engaging with them. Clinicom not only can help you address the right issues in the right order, but also track and monitor the patient over time by doing follow-ups. So this particular patient has several follow-up assessments done, and you can see what those are. You can also look at the diagnosis here on the summary page and make edits right here within the section. It does capture whatever medications the patient had been reported on. But most importantly, Clinicom has a very powerful tool to follow up with your patient. So for this particular case, we're going to create a follow-up, this bipolar female. And because the clinician has accepted mania, insomnia, and ADHD for this patient, Clinicom automatically created this follow-up to suggested follow-up for your patient. Obviously, you do not have to use our suggestion, but if you wanted to, you can quickly just create at the very bottom right corner, it says create follow-up. You can then send the assessment on a certain date. You can then also set a frequency. So let's say I'm going to monitor this patient for a whole year. Pardon me, let me get back to there. Monitor this patient for an entire year. I'm going to do this assessment once a month for a year. You can quickly hit send, and this patient will then automatically be tracked and monitored with whatever follow-up you created on the far right for that year. We have certain clients that actually ask for us to automate certain cadences and frequencies. So let's just say they want certain measures every 6 months or every 3 months. We can automate that as well. We have some substance abuse clinics that want to measure certain things on a weekly basis. We can automate that as well. So you don't have to manually go in here and set this up for your patients. You tell us what you want. We set up the cadence and frequency, and that is done. To customize this, let's just pretend for a second that you're a new clinician using Clinicom. You don't really trust our suggestions. You can then delete our suggestions, and you'll see here that the control arm is still here. The control arm, like I mentioned previously, it can be tailored to your location. So if you have a certain specialty or subspecialty, you can use any one of our standardized instruments to create your control arm. And on the left here, you'll see suggested scales by condition. So these are conditions that we accepted or rejected. So these are the accepted conditions of sleep conditions, ADHD, and bipolar. What's also important to note here is there are some clinician-facing assessments, Handals, mattresses, etc., that you can do on your patient. So you can also send a follow-up to be clinician-facing that you can actually do at your visit with your patient as a clinician. There's an entire litany of standardized tests in our library. So you can quickly, if you wanted to follow up on anything else for this patient, or send, let's say, an ACE-Q, or add any other, a HAM-D, or excuse me, a HAM-A, you can do that as well. So there's a long library of standardized assessments in our library, along with our proprietary DSM-based criteria questionnaire. So let's just say your patient said, hey, you know, doc, I forgot to tell you, I am really just having a lot of problems with you know, panic disorder, and I just didn't tell you in my initial intake. I was scared to tell you. So you can quickly add an algorithm to your follow-up to assess for any individual condition, or reassess at a later time and gather more information. You can also send any one of our informational questionnaires or biopsychosocial information. So if you send a Clinicom on the first visit, and you want to send the elements of Clinicom Pro, the biopsychosocial elements, you can do that as a follow-up. And you know, you can tell us, hey, visit 2, I want to send this on every patient. We can set that up for you automatically. So this is as easy as sending. Clinicom will send reminders, make sure they complete it. There's a 94% completion rate. So once you set this up one time on your patient, it's done. You don't ever have to do it, you know, for that time period again. It's going to gather all this information for you remotely. We also get asked, you know, hey, I haven't seen our patient in 2 years, right? They used to see me and they're back now. Instead of creating them a new Clinicom account so you have duplicate entries in your patient list, you can just open up your old Clinicom account and click send a Clinicom. And this will reevaluate them for 80 conditions. And so you know, don't have to start a new account. It can quickly gather that. So in the course of care, I wanted to just show you how quickly this could be done for any patient. It is rather quick and very easy to not only extract information, pull the PDF, but also to add a follow-up. It could be as easy as just clicking add a follow-up, clicking create follow-up, repeating your sequence, and hitting send. It is that easy. It literally could take you 10 seconds, and you can have your patient monitor for an entire year. Clinicom, we do not charge by assessment. It's really important to understand that, you know, Clinicom is only $12 for a patient for an entire year of monitoring. Includes their comprehensive assessment and unlimited follow-ups for a year. So whatever cadence you track and monitor your patient over that time, Clinicom will gather this information for you and graph it for you over time at no additional charge for up to an entire year of monitoring on that patient. So Clinicom is quite powerful and can help with various aspects of just lowering the burden of clinical documentation, workflow, and optimizing care for your patients. There's also some very powerful statistical tools within Clinicom for population health data. So if you have multiple locations, a hospital network, an insurance company, stud clinics, you can have, we've been using IBM Watson or the IBM Cloud for 15, 16 years. We are connected with IBM Watson and Power BI. So you can have all this information and completion rates, demographics at your fingertips for your location. Clinicom statistics can actually instantaneously on demand show you your cohort level and what conditions your population, based on the accepted and rejected diagnosis, what conditions your population has. So as an example here, the third one for this example is insomnia. Maybe you don't have somebody who specializes in sleep and half your patients have sleep issues. Maybe that's, for resource allocation and understanding how to expand your business. This is really helpful. Also has cohort level population outcomes measures. So if you said, hey, show me PHQ-9s on location 5, Dr. Smith, or a certain cohort level, we can show you how your outcomes are trending for the various different assessments that we have within the portal. Clinicom also has a very powerful comorbidity assessment as far as looking at data for, let's just use ADHD, for example. So here we'll select all our patients in this sample size that have ADHD. They pulled up 2,400 patients for this demo account. You can select the severity, the minimum severity to look at. So we'll just click normal and a certain age group. You can select whatever age group you want. And now you're looking at the comorbidities that the patients with ADHD have within this cohort. So within the 2,400 patients with ADHD, you'll see here that, 64% of them have some symptoms of learning disabilities. It's not a shocker. But what is kind of interesting here is that 64% of them in this cohort had some symptoms of OCD. So this is really powerful data to help you understand not only your clients, your patients, but also treatment outcomes for your staff and locations. So Clinicom is a very powerful tool. It's an easy to use tool. It's very easily scalable for multiple sites, multiple reporters. Happy to dive in a little bit deeper with you on that. But that is, in summary, that is a brief overview of Clinicom.
So Iggy, I have a couple of questions, and let's talk about how the time savings occurs from the front office all the way to the clinician. As far as time savings, we always talk about an exponential, force multiplier in terms of how much time and accuracy is gained by the individual clinician. What are the most common time lengthy tasks that Clinicom can solve almost immediately?
So one, in clinical, the intake, right? So taking that time away from a staff member who may do a consistent intake, may not do a consistent intake. So you're empowered with all this information initially. So removing that burden from your staff on the front end. And also from the clinician, having not spending the first 20 or 30 minutes of their initial intake jumping down rabbit holes with their patients. So you're saving those first 15, 20 minutes. You have that information all in front of you, and you can immediately start addressing issues. The other thing is, we find over time when our clients and sites start using Clinicom that their no-show rates go down, right? So the more of their patients are showing up because they're engaged prior to actually meeting, they've given the information they want to see the results, so they're going to show up. The clinician is then going to save this time and be empowered with the information to get to a more accurate diagnosis quicker. We've had a lot of data across various sites of how much time that can save. One of our large enterprise accounts just last week was telling us that it saved 22 days to treatment for them for a large national TMS center that empowered their staff as a force multiplier, taking one screening person and empower them to be 2 or 3. Once again, Clinicom is never late, can work day or night, and assess an unlimited amount of people. So if you said, hey, Clinicom, I want to screen an entire city, as an example, New York City, and we could assess, we had their email and phone number, we could assess most of the population in that city in a 48-hour period and triage them according to the care level needed.
Great. So in terms of the time-saving features of documentation, um, beyond just the actual, note taking and things, how much time on average does a clinician save per patient just transferring soap notes and things like that?
Yeah, we have a lot of clinicians that tell us before they get going with us that they spend their evenings and after dinner finishing notes and finishing soap notes and reviewing cases and making sure they documented everything. With Clinicom, you're not gonna miss that. You're not gonna have to be typing while your patient's describing stuff or recording something. You will have that information already at hand. So you're going to save a quick 15 to 20 minutes. Most clinicians say they spend 20 or 30% of their time on documentation. This should cut this in half. But it's different for everybody. Depends on some clinicians want to write a very, very long soap note. Some do shorter. So it's different for every case. But we know that across the board, Clinicom is going to save you time, energy, and when you go home at the end of the day, you're not going to feel like you forgot something, or maybe, well, what questions did I forget to ask? You'll feel whole and be able to rest with your family, not knowing that all this was already done for you.
Right. And then the other point that we might want to expand on is that you did mention things like you have seen clinicians that have actually a monitor within their practice or share it via telehealth if that's the particular situation. That is unlike what we've traditionally seen in a clinical environment. We do see that when it comes to doctors and looking at x-rays or particular blood work or numbers or things. And when you're a patient for a primary care physician and you have, say, cholesterol numbers or things that you want to reduce and work towards your personal goal of doing that, you actually have a target that you can reach for. And Clinicom is one of those things I think that also provides that tracking environment where a patient can engage and participate even further in their treatment than ever before. Can you
So,
highlight or illustrate some of those situations?
So yeah, a lot of times especially for SMI, it's very challenging to get patients to accept that they may have bipolar or schizophrenia or some very significant condition. So what's really powerful is we have clinicians that print out both there's a patient version of the report that has a little bit less information, a clinician version, so you can have both printed out. We have clinicians that literally share this on a monitor in their room, going with the patient symptom by symptom and saying, hey, validate these answers with them. So the patients actually see what conditions or what symptoms are contributing to their condition. So for not only patient education, awareness, but helping with making sure they take their medicines, right? So if they understand they actually have this condition and what symptoms are driving it, they're more likely to take the medicine or treatment that they're going to be prescribed. So having this on a monitor, a lot of people cast this on a monitor in the room with the patient or on a telemedicine visit to educate patients on the use of what's going on and what's contributing. Patients love to understand and follow along with their clinician and say, hey, I've had these symptoms for 3 months. Look how it's trending. It's getting better or worse. It really improves engagement. And then also for educational purposes for residency programs, right? We have different settings where people are using this to train their staff to make sure that they're not making mistakes and they're not forgetting to review certain things with patients. So this is a helpful educational tool for patients and new mental health providers.
All right, outstanding. I believe that should conclude everything unless there's any other points within the deck that you wanted to go over, Iggy.
No, I just want to welcome everybody to going to those 2 links. Margaret, you can put that last slide up with our 2 links. So there's Clinicom/free trial if you want to get started, no cost, no risk. I say send it to a patient, see what your experience and your day is like walking into the room with all this information and how much time it saves you and how happy your patients are to feel heard and understood and not rushed out of a room. Clinicom/onboarding has a lot of helpful information if you want to dive a little deeper, understand the clinical guide or some of those other information. If you want to schedule a meeting with us and get to know us a little bit better, you can do that at that Clinicom/onboarding. And welcome everybody to take a look. And we appreciate your time.
All right. And with that, we will end our webinar. Thank you very much. We will have this replay on our website within about 10 minutes or so. So if you need to catch up on it, or if you missed the beginning, we certainly have the playback available for you. Thanks for attending, everyone. Have a great day.